So hello everyone. Today we'll be completing the whole of Hematology and Oncology section from the Uworld. So beginning with question number one. Nephrotic syndrome is a hypercoagulable state. That is, some of the anticoagulating proteins are lost in the urine. Therefore, the blood causes hypercoagulative state. There is in nephrotic syndrome there is sudden onset abdominal flank pain, hematuria, and left-sided varicocele. So varicocele occurs because renal vein directly so the testicular vein on the left side directly goes to the renal vein and in a perpendicular fashion. Therefore, uh, there is some sort of renal vein thrombosis as well, which results in varicoceles. Thrombosis occurs in the renal vein because of the hypercoagulable state and loss of anticoagulant factors, especially antithrombin 3 is responsible for the thrombotic and thromboembolic complications of nephrotic syndrome. So antithrombin 3 is lost in the urine, therefore there is thrombosis throughout the body. So both the second is both hepatitis B virus and C virus infections increase the risk of hepatocellular carcinoma. So SBB and SCB are associated with HCC due to chronic hepatic inflammation and cell turnover. So there is some, hepatitis B virus had some malignant genes as well, SBX antigens, so which is also a carcinogenic, which causes production of oncogenic proteins and insertion of SBB genome into the host chromosome. Therefore, the host chromosome, while multiplying, replicates the viral DNA as well, therefore causing hepatocellular carcinoma. So SBB and HCB are one of the important causes of hepatocellular carcinoma. So black pigment stones arising from the conditions that include the amount of unconjugated bilirubin in bile. So unconjugated bilirubin in bile. So in the bile, so bile is formed by uh, you know two different factors, which are the cholesterol and the bilirubin. So cholesterol, the unconjugated bilirubin, is formed due to hemolysis in the blood. Hemolysis, the hemolytic unconjugated bilirubin is high in amount rather than the bile salts. Therefore, there occurs precipitation of uh, the stones, so which bind with the calcium, causing black pigment stones. So black pigment stones arise from condition that include the amount of unconjugated bilirubin in the bile, which promotes calcium bilirubinate precipitation. So calcium bilirubinate is dark color, so black color. So calcium is actually white, but calcium bilirubinate is actually black. So black pigment stones arise. This may occur in the setting of chronic hemolysis. Example: sickle cell anemia, beta thalassemia, hemolytic assessments, hereditary spherocytosis, and increases intrahepatic cycling of bilirubin. So ileal disease. So in ileal disease, the bile cannot properly move distal to the ileum into the rectum, and it disturbs intrahepatic circulation. It rather increases the amount of intrahepatic circulation, and therefore there is more concentration of more unconjugated bilirubin in the bile, thus black pigment stones form. So now let's talk about von Willebrand factor. So von Willebrand factor is actually present inside the endothelium. So it enhances protein through both augmentation of the platelet binding. So platelet in the injured vessels, endothelium. The endothelium, inside the endothelium, has collagen fibers, which when exposed during any sort of injury exposes that collagen where platelet bind, and it also helps in the stabilization of factor 13. So platelets with von Willebrand disease are deficient in functional von Willebrand factor. So patients with von Willebrand disease are deficient in functional. So the von Willebrand factor does not function well. Therefore, there is lack of platelet binding to the endothelium, and thus no platelet aggregation and accumulation. So it causes increased bruisability and prolonged mucosal bleeding. So, and there is something called DDAVP. So DDAVP, which can elevate bleeding through initial release of von Willebrand factor. So DDAVP, AVP. So what is the full form of DDAVP? So DDAVP is actually desmopressin. So desmopressin can decrease bleeding. How? So desmopressin causes the release of endothelial endothelial von Willebrand factors, and so von Willebrand factor, the functional von Willebrand factors causes or decreases the bleeding. So if there is von Willebrand disease, then DDAVP, which is desmopressin, can decrease the bleeding. Now let's talk about hemosiderosis. Hemosiderosis or iron overload is a common and serious complication of chronic hemolytic anemia and frequent blood transfusions where there is iron overload in chronic hemolytic anemia. So if there is hemolysis, a lot of hemolysis means a lot of RBC rupture, a lot of RBC with the hemoglobin containing iron gets into the blood, and there is frequent blood transfusions as well. So hemosiderin accumulation is the cardinal histological finding. Hemosiderin accumulation is the cardinal histological finding. Okay, hemosiderin deposits in the various tissues, including heart, causing dilated cardiomyopathy as well. So chelation therapy is indicated to decrease the parenchymal iron deposition. So to decrease the amount of iron precipitation into the tissues, there is some chelating agents like uh, like I hope you know it. I forgot some the names. So chelating agents can be used to decrease the parenchymal iron deposition in the tissues, thus decreasing the complications of hemosiderosis. Also, it is important to note that hemosiderosis is one of the causes of liver cirrhosis as well. Okay. So P53, what is P53? Is a tumor suppressor gene. P53 is a tumor suppressor gene. So tumor, there is there are two ways how a cancer can develop. If there is excessive amount of oncogenes or if there is decreased amount of tumor suppressor genes. So P53 is a tumor suppressor gene that controls cell division and apoptosis. So when the suppression is inactivated, so P53 is a suppressor. So when the suppression is inactivated, then it causes many tumors. Now the next point is about P450 microsomal oxidase systems. So the P450 is microsomal oxidase system. So microsomes. So P450 is one of the cytochrome oxidase systems. So cytochrome P450 is actually present in the liver, which helps in biometabolism. So biochemical changes that takes place in the drug in when we take any drugs. P450 microsomal oxidase system plays an important role in detoxification in CCl4 poisoning. So with this carbon tetrachloride poisoning, however, it produces free radicals that starts a vicious cycle of hepatic injury. So when CCl4 means carbon tetrachloride is poisoning occurs, then carbon tetrachloride forms some Cl plus Cl dot free radicals in the liver itself. So which has to be decreased or detoxified by the cytochrome P450 microsomal oxidase system, but because of excessive amount of free radicals, there is severe hepatic injury in the liver as well. So the next question is the next objective is urothelial or transitional carcinoma is most common type of bladder cancer, bladder CA. So one of the most common type of bladder CA. So bladder CA occurs because of nitrogen containing compounds, nitrosamines. Actually, nitrosamines are more linked with stomach cancer, but bladder cancer has also relation with smoking. And the tumor stage is most important factor for determining prognosis. So tumor stage, so stage of tumor TNM, among the TNM, T stage is the most important factor for determining the prognosis and based on the depth of invasion. So T stage tumor, how deep has the tumor gone is one of the important key determining factors for the prognosis of the urothelial carcinoma. It's based on the depth of invasion into the bladder wall and the degree of spread of those tissues. Tumor invasion into the muscular layer of the bladder wall carries an unfavorable prognosis. So the deeper the tumor goes, the worse the prognosis of any tumor is. So urothelial carcinoma is one of the most common type of bladder CA, and the stage of the tumor, the depth of invasion of the tumor is actually the third determining factor for the prognosis of any of the tumor. So now let's talk about cystic fibrosis. Cystic fibrosis, that suggests a malignant cause of back pain. CFX, that suggests a malignant cause of back pain include the occurrence at night not relieved with rest or analgesics, advanced age, and systemic sclerosis. Systemic symptoms, I think. The common associated with the propensity for bone mets include prostate, breast, kidney, thyroid, and lung.